everyone. It's Dr. Tamara Beckford with URCaringDocs. So URCaringDocs, we're a telemedicine urgent care company that help people who want to see a doctor quickly for their non-emergent medical issues that occur at inconvenient times. But every Friday at 6:30 right here, we provide medical information. So we're not diagnosing anything. We're just teaching you what's going on inside your body so that you can understand, you can make great medical decisions, right? So today we are going to be talking about gallstones and gallbladder infection. Yes. So we're going to go through a myriad portion today. So today you're going to take it all the way back to chemistry class in high school. Then we're going to go over some anatomy. And, I have my drawings. And then, of course, we're going to go over some medical terms so you kind of understand. So if you're reading your report and you're like, what are these people talking about, these big fancy words? We kind of broke them down for you, right? So medical terms, how gallstones are formed, where's the gallbladder, what happens when it becomes infected, how do you treat it, all of that. So I'm glad that you're here. However, let me know if you like the information that you're getting today. Don't forget to like, subscribe, share. Don't keep all this great info for yourself. Let somebody else know what's going on, right? Because now you're so knowledgeable. Let's get started. Like I said, we're taking it back to chemistry class. So, how are gallstones formed? I mean, like, all of a sudden you're hearing, yeah, you got gallstones. You're going in, you're having this pain, and you told you got gallstones. And you're like, well, how did I get gallstones? So, this is our chemistry portion. So all of this right here is going on inside the gallbladder. We'll go over where the gallbladder is in my next drawing, right? So inside the gallbladder, it produces bile. So bile makes the area become acidic. So the acidic bile helps to dissolve cholesterol and calcium salt. So when we're eating all our food filled with cholesterol, calcium salt, yep, it gets dissolved. Then it gets super saturated. So even though I made this look like a container, this is still your gallbladder, right? So it gets super saturated there. And then after the super saturation occurs, then precipitation occurs. So I made it into this two separation because with precipitation, all the contents, which is all our cholesterol and our calcium salt, starts to kind of go to the top. And then once the precipitation occurs, then we get the crystals. So those crystals start to form, and those crystals are your gallstones. Yes, the gallstones. So what are some of the symptoms? Alrighty, so you are at home and you enjoyed your French fries, your cheeseburger, you had that pizza, your enchiladas, and you just went to town. And you're like, oh, I feel so good. And you go to sleep. And then, boom, in the middle of the night, you wake up like, what is going on? Usually the pain is on the right upper portion of your stomach, right? Or that is the abdomen. That's the medical term for that entire area. But generally people call it their stomach, but it's the abdomen in the right upper portion. You wake up with like, oh my God, that's a pain. The pain just kind of goes up. So we've already talked about the formation of the stones because our meal had a lot of fat and cholesterol in it. So we've already made some stones and they're just chilling in the gallbladder. Now, where's the gallbladder? Here we go. So this is our gallbladder right here. So our gallbladder here now has the stones. This is underneath the liver, and the liver is on that right upper portion of the abdomen. Underneath, tucked in, is that gallbladder. So the gallstones are here in the gallbladder, and then the stones, the gallbladder, you ate your fatty meal, and the gallbladder is trying to dissolve this. That's their job. You eat anything oily or fatty, it's gonna shoot out its bile and try to dissolve that meal so that you can absorb the nutrients. So if you have a stone and it's trying to shoot it out and dissolve the meal, then it squeezes and the stone is stuck in the neck. Hey, Brazilius, you're saying, I'm kind of late. What are we reviewing today? We're reviewing gallstones. So we've just said that we have a gallstone And we are describing what is happening when you eat a fatty meal and you have gallstones. So you have the bile trying to get out of the gallbladder in order to help you to dissolve this fatty meal, right? But the stone is here, so it gets stuck. So if you imagine you have a balloon and you have a stone that's stuck in the balloon and you're trying to squeeze the air out of the balloon, but there's this object that's stuck there and you're squeezing and you're pushing and you're pushing and you're pushing, trying to flatten that balloon, it causes a lot of pressure, right? Because the object is blocking all that's going on. So that's what's happening with your gallbladder when that stone is stuck and the gallbladder is squeezing. And as a result, you get a lot of pain, a lot of pain. So that continues, and then the gallbladder can become infected. So gallbladder become infected, there are a couple of things that you start to see that they're considered the signs of a gallbladder infection. So you have gallstones, which is here, plus the Murphy sign. The Murphy sign is you're lying on your back and you press on that right upper and you're like, you take that deep breath in when they press underneath the liver because the gallbladder is infected and it hurts. So that's our Murphy sign. So when you go to the emergency room or you go to your family doctor, or someone's doing an ultrasound and they even do the ultrasound because they're looking for gallstones and they even press on that area with the ultrasound machine and you that's a Murphy sign, right? So we have gallstones plus our Murphy sign. Now the gallbladder wall becomes thickened because of all this persistent pressure of trying to squeeze that bile out and you're unable to get it out because of that stone. And then the gallbladder wall becomes thickened, and we are able to see that on the ultrasound. So with the gallbladder wall thickening, the stone, the gallbladder is distended, and your Murphy sign when we try to touch underneath that right portion, all of that gives us a sign that you have an infected gallbladder, an infected gallbladder. So now we know those words, infected gallbladder, your gallstones, and your eventually the next step would be to either one, if it's infected, you got to get it taken out, right? If you do not have an infection, but you have the gallstones, and based on your lab work is how we can determine that, plus the ultrasound, or some people can get a CAT scan. It can tell you if it's infected or not. So if it's infected, you got to get it taken out. If it's not infected, then we just call it a colic, which means that you have the stone. It hasn't been infected yet. However, if you keep eating those oily and fatty meals, there's a chance that you can become infected later on, right? So if you have gallstones, we're going to learn some medical terms right now. So gallstones alone are called cholelithiasis. So I underlined the word lithiasis because lithiasis just means stone. Of the coli is our gallbladder, right? So if the gallbladder is infected, we already mentioned that anything that ends in itis means an infection of whatever is before it, right? So an infected gallbladder is called cholecystitis. Cholecystitis, right? Now, if your gallbladder is infected, you're going to need to get it removed. And that last term is called cholecystectomy. Ectomy means that we're going to remove the gallbladder, right? The gallbladder, removal of the gallbladder. So this is the surgery to remove the gallbladder. So I hope we do understand what's going on. So we talked about a couple things today. We talked about one, how we form gallstones, which are basically our chemistry lesson that we learned in high school that's just going on inside our body. So the acid within our bile plus the cholesterol salts precipitate to the top, and then it forms crystals, and that's gallstones. The gallstones are located and stored within the gallbladder, and if we eat our oily, fatty meals and our gallbladder is trying to release its bile to help us to digest that, and there's a stone stuck in the neck of the gallbladder here, then we can become infected. The gallbladder becomes infected, and we can get an cholecystitis, which is an infected gallbladder. If we do have an infected gallbladder, we need to get it removed, and the removal of that surgery is called cholecystectomy. That's the removal of it. If you do not have an infected gallbladder, but you're having stone and you have the pain that comes and goes with it, then it's called colic, right? Which is a biliary colic. Alrighty, I hope everyone understood. I hope you enjoyed our little talk today on gallstones and gallbladder disease. Well, we only talked about one of them, which is the infection of the gallbladder. If you like the information, please leave a comment, subscribe, share this info with others. Don't keep all this great info for yourselves. And remember, I'm Dr. Tamara Beckford with URCaringDocs. URCaringDocs is a telemedicine urgent care where we aim to help people who want to see a doctor quickly for their non-emergent medical issues that occur at inconvenient times. But every Friday, we go over a medical topic so you understand what's going on inside your body. Thank you guys for tuning in. We'll have a new topic next week, Friday. I'll see you then. Bye-bye.